Hello, I want to thank you for taking your time and joining me as I discuss my paper. For week 17 of our course, our instructor provided important facts on the many public health crises our nation is currently facing, one of them being the drug epidemic. Many people will my paper will focus on a specific drug called carfentanil. With more of these more potent drugs making their way into our communities daily, one must wonder if current reversal agents will continue to be as effective in combating opioid overdoses. I have titled my paper, How Effective is a Reversal Agent with a Carfentanil Overdose? Throughout the generations across legal or illegal means, the history of opioid uses as a tool for the management of pain within human capability has continued to be anything but stagnant, with records showing the aging time use of opium to the use of laudanum, later on to pure morphine, then pure heroin, and now to a newer version of potent opioids in the form of synthetic drugs such as carfentanil. One must ask the question of how powerful must reversal agents be in treating opioid overdoses, whether accidental or not. Can a reversal agent such as naloxone be strong enough to combat the potency of a life who is undergoing a carfentanil overdose? Due to the lack of research and underestimated data on carfentanil-related overdoses and deaths, the general population, including medical professionals, are not aware of the dangers that are involved with these newer and stronger opioids that are being sold and distributed, causing overdoses as well as deaths daily within the United States alone. We will now go into carfentanil's identity. Even though morphine and heroin are derived from the opium poppy, carfentanil is an analog of the popular synthetic opioid analgesic called fentanyl and is one of the most potent opioids known, also the most potent opioid used commercially. And this is according to National Center for Biotechnology Information. Carfentanil's identity is considered completely synthetic, meaning its analog would not be in existence unless it was chemically handled and treated up by human hands to come about. Even though national headlines have brought recent light on how carfentanil is being consumed by humans, this type of opioid was first synthesized in 1974 by many chemists, including a chemist named Paul Janssen, which was the founder of Janssen Pharmaceutica, and was intended for use as a tranquilizer for the sedation of large animals, such as horses, and administered only by experts like veterinarians or zookeepers. It has a quantitative potency approximately 10,000 times that of morphine and 100 times that of fentanyl, with activity in humans starting at about 1 microgram. And fentanyl, like I previously mentioned, is intended for large animal use only, as its extreme potency makes it inappropriate for use in humans. And this information I gathered from the National Association of Drug Diversion Investigators. The DEA, the Drug Enforcement Agency, has also scheduled carfentanil a Schedule II controlled substance. This type of federal scheduling supports that this synthetic opioid has an elevated possibility for abuse that can lead to psychological or physical dependence, making it an issue of high concern. With its lethal consequences, why then would humanity continue to manufacture this product, or worse, misuse it by human consumption? And many might wonder why go to fentanyl? From a professional and legitimate standpoint, within a medical setting, it makes sense to have a reliant sedative available when a job calls for one, when administered by qualified personnel. Yet, from an unlawful position, the motive behind the manufacturing of carfentanil continues to be the same: a money-making influencer used to cut other drugs, maximizing profits for entities in the black market. From the very small number of studies available, for the person misusing such a deadly addictive method, most individuals don't even know that their drug of choice is being partially substituted by a deadly additive such as carfentanil until it's too late. Even coroners have misrepresented information on their patients' death records because there are little to no ways of detecting carfentanil when the bodies are examined. The US Surgeon General Jerome Adams, when addressing the opioid crisis, mentioned that Each day we lose 115 Americans to an opioid overdose. That's one person every 12.5 minutes. But in reality, these numbers can be considered underrepresented. With the lack of resources available and targeting better detecting techniques for possible traces of carfentanil in any type of setting, including medical emergencies, where first responders and law enforcement can easily encounter this opioid, which can cause accidental exposure. Even a small amount of carfentanil, the size of a small grain of sand, can cause death if inhaled or is saturated within one's skin through close contact. Detecting, detecting issues motivate other alternatives. While detection issues continue to be a setback in identifying possible carfentanil traces leading to overdose or death, the U.S. Surgeon General has created a digital postcard explaining how cooperation of all levels of community members around our country can be prepared in handling opioid-related incidences by having naloxone on hand and being ready to administer the product. I have a copy here. I don't know if you can see it, explaining what measures we can take in helping preventing the misuse of opioids. The five subtopics are talking about it, being safe, understanding pain, knowing addiction, and how to be prepared. And now I'll be speaking about naloxone, which is a reversal agent. With the Surgeon General requesting its communities to take part in having an opioid reversing drug available that could mean saving a life, it is important to know what exactly is naloxone and is it strong enough to battle the effects that fentanyl causes to the human body. Naloxone is a medication, a nasal spray that is given intranasal during an opioid overdose because it is considered an opioid antagonist, meaning it attaches to opioid receptors and reverses or blocks the effects of other opioids. Naloxone further assists individuals in restoring their breathing if their breathing slowed or stopped due to an opioid overdose. This information I gathered from the National Institute of Drug Abuse. The FDA has now approved an 8 milligram nasal spray compared to a 2 milligram and a 4 milligram nasal spray that were previously offered as assistance towards overdose care with or without a prescription. Thankfully, more local organizations are beginning to participate in offering this product, some with training included, all free of charge, to help its communities be prepared. Aside from the opioid epidemic the US is currently encountering and the potent threats carfentanyl's lethal doses produce, controversy remains on whether there is a need for higher doses of naloxone to be given to people who have overdosed by mishap or accidental exposure. Although there has been much debate regarding the safety of high, excuse me, high dose naloxone, with critics citing the risk of pulmonary edema, there are documented events where naloxone has been used in higher doses in patients who endured carfentanil overdoses and survived. In an article in the American Journal of Health System Pharmacy, two patients at a small community hospital were under cyanosis and respiratory distress due to a suspected carfentanil overdose. Were given a higher than normal dose of naloxone. Patient one was given 12 milligrams and patient two was given a total of 10 milligrams for resuscitation. The use of high dose naloxone prevented the need for intubation in these patients, concluding that emergency personnel should be comfortable using higher than standard doses of naloxone in appropriate cases. Keeping in mind that higher doses should be administered and are recommended for personnel who are trained at a professional level compared to a pedestrian who should continue to follow the directions of the naloxone nasal spray bottle until EMT arrives, emergency medical technicians. With carfentanil being an issue of high worry, community members are recommended to carry the naloxone nasal spray with them if possible. This type of aid has become as important as knowing cardiac pulmonary resuscitation, also known as CPR, which helps individuals who have also stopped breathing for numerous reasons. In conclusion, Due to carfentanyl's strong potency, it is not irrational to speculate the need for higher doses of a reversal agent to be implemented as a required course of action in helping individuals resuscitate after an opioid overdose. Credibly speaking, although naloxone and other opioid overdose reversal agents are not always a cure-all for every opioid overdose case, this type of support can unquestionably be seen as an extended lifeline for any individual who has been able to recover from the overdose and hopefully is willing to pursue further help in seeking treatment and rehabilitation services. Choosing to keep hope alive by helping others realize the importance of life itself within oneself is one of the reasons why the helping professions exist. History has endless records of trial and error, but also of triumph and accomplishments. And any tool available that can continue to help save a life from self destruction should be valued and used for its purpose. Once again, I thank you for your time.